Health Economics 101. So kind of some basics as it relates to Health Economics 101. I'm not going to do any graphs or tables or any formulas or calculations, so don't worry about that. What I really want to do is to distinguish between two purchases. So in one purchase, I'm not an artist, so I want to apologize for that. So in one purchase, you're going to buy a car. So that's my example of a car. So that will be scenario A that we'll review. And scenario B that we'll review is you're actually going to purchase some type of health care service. So let's say, for example, you're out in the yard or you're outside and you happen to cut yourself and you have a laceration. So now you have to go to an urgent care center. And then when you go to the urgent care center, they're going to put in sutures or stitches when you go to the urgent care center. So I first want to look at is how exactly do you pay for the car? And then we'll contrast that with how do you pay for these healthcare services because you have a particular cut. So let's begin with the car as an example. So this is you right here. So you are the buyer. And then what you're going to do is you're going to enter kind of the, if you will, the car dealership. So you're going to go to the car dealership and you're going to interact in a lot of cases with someone that's a sales rep. But you may be armed, if you will, from information that you got from the internet as it relates to prices and other types of things that are important for you. So you're an informed consumer and you're going to interact with that particular sales rep. So the sales rep says to you, for the car that you want, it's going to cost you $30,000. And then you might say, you know what, I looked online and that car actually should cost me $28,000. And I'm not paying a penny more. I'm going to pay $28,000. So you go back and forth, and then finally the sales rep says to you, tell you what, it's yours for $29,000. So the thing about this is it's a known price. You know you have to pay $29,000 for this car. So you know that up front. Known price. Remember that. Known price, you have to pay $29,000. So let's assume that you're not going to finance it, so there's not going to be interest. So what you do is, and let me kind of exemplify this in a different way. So what you do is, you're the buyer, and then you have the sales rep here, so SR for sales rep. So you're going to give the sales rep $29,000, and in return, you're going to get your car. So the deal is done. So it was a cash transaction, and the money is exchanged, and you get your product. And the other thing that I wanted to emphasize again is it's a known price. So the price is 100% transparent. 100% transparent. So that really does wrap up transaction A. So now let's go to transaction B, which is the healthcare transaction. So again, in the example that I want to illustrate is, let's say you cut your arm and you can see blood, you can see a little bit of tissue. You have the sense that it probably needs to be stitched up. So you go to the urgent care center in your community, and then, so this is you, So you're going to go to the urgent care center, and this is the urgent care center that I'm drawing right here. So you go here, these are little droplets of blood, if you will. So you're probably going to meet with the front office person. So the front office person hopefully is going to smile at you, and they're going to ask you a whole series of questions. And many of these questions are going to relate to what? Your health insurance. So are you insured? What type of insurance? So those are some of the questions that you will be asked. What will also happen too is, so this is you, again, little drops of blood, and this is the front office person in the urgent care center. So you're going to have to pay a copay because you're going to do this urgent care visit. And then in return, they may ask you for information as well as give you information. So in order for you to access these services, not only do you have to pay a copay, but you also have to know what your co-insurance is. And your co-insurance is always a percentage of the final bill. So your co-insurance is a percentage of the final bill. So you meet with the front office person. Eventually, you have to get to the provider. So it could be an NP, nurse practitioner. It could be a PA, physician assistant, or it could be a physician, depending upon the structure of the urgent care center. So eventually, you have to connect with them. So let's say all is going well. So you meet with the front office person. Front office person checks you in. Still got a little bit of blood. So now you're sitting in the waiting room. And you're waiting now to see a provider in the urgent care center. So you're waiting for about 20 minutes, somewhat patiently. And then all of a sudden, the receptionist says, please come back. So now you go to an exam room. So now you're in the exam room, and what are you doing in the exam room? You're, in essence, just waiting in another chair in the exam room, still with a little bit of blood. So you're just waiting there. And then who typically may walk in, it could be an MA, medical assistant, it could be a nurse, or it could be a tech. So now they walk in, and what they do is they take your vitals. So they take your pulse, your temperature, your blood pressure. They record that in the electronic health record, and then they say the doctor, the PA, or the NP will be with you, and then you just sit and wait. Again, here's the exam room. So you're waiting in the exam room to be seen by the provider. So here you are, sitting in the chair patiently. So you're here for 15 minutes waiting. Yep, still a little bit of blood. So in walks, your provider. So your provider walks in, and your provider will ask some questions. They will also do what's called a history. They will also maybe do a very, very light physical exam. They will, in particular, examine your injured arm and then make a decision about what to do. So let's say that after this examination period, this is you, this is your provider. So that's the provider, that's you. So the provider gives you stitches. So that's what the provider does. So in return, what do you give the provider? It's not actually the provider, him or herself, but actually to the urgent care center, is you have to give them money for this service that was provided. So for the provider, when they give you the stitches, they're going to have to link it to a diagnosis, the International Classification of Disease number 10. They have to link it to a diagnosis, DX for diagnosis. Then they have to make sure that it's linked to a billing code, and we use CPT codes in healthcare. So they have to link it to a billing code. So once that's done, then a bill is generated, and that bill specifies the amount to be paid. So here you are. So you're all stitched up, no more blood, all is well. And this is kind of the checkout desk. So there's a little checkout desk. And then here you have the person that's going to check you out. So you're feeling satisfied with the service that was being provided. And then now this individual tells you, finally, how much your bill happens to be. So now you know how much your bill is. Why is this important? You didn't know how much you were going to pay up until this point in time. So now it's known what the price is, and now you can calculate your coinsurance because your coinsurance is a percentage of the known price. So that's typically what happens within healthcare. But since you have health insurance, you don't have to pay 100% of the bill. Yep. You have to pay your percentage, the coinsurance, and remember you already did the copay, and that was taken when you first came to have the service rendered. So let's look at the differences between buying the car, which is A, and having a healthcare service, which is B. So what are the differences between the two? So in this one, the first difference is you had a known price, $29,000. Crystal clear. The other is there's no copay, there's no coinsurance, there really is no financial intermediary in buying the car. Now, when you paid for these healthcare services, because of the cut, you did have an intermediary. And the intermediary is the health insurance company. You knew what the copay was because that's fixed. You did not know what the coinsurance was initially because you did not know what the price for the service was going to be. SVC is for service. Once you found out what the price for the service was, then you knew not just the price, but also you knew what the coinsurance was. So the major difference between scenario A, buying the car, and scenario B, getting healthcare services, the major difference is this is transparent, and in many cases, this is not transparent. So those really are the major differences. This is almost zero risk. This entails some level of financial risk to the patient. So I think it's extremely important when you think about kind of Health Economics 101 is you begin to realize how there are different transactions and how healthcare works in a slightly different way. But to be fair, there is some movement that's occurring right now. So I portrayed to you scenario number A, buying the car, fully transparent. Scenario number B, going to the urgent care center. There is an emerging model called C. So if you think about some of the retail medicine clinics like Minute Clinic, what they're beginning to do is have price transparency. Medical tourism. If you want to get a hip or knee replacement, you may know in advance 100% as to what the total price is going to be. So there is a movement within healthcare to have more transparent pricing on both sides. That's good for the consumer, that's good for the provider, it's good for the health plan. So I think it's important for you as we continue to go through this particular course that you stop and ask yourself the question is, how is this being financed by the patient, by the health insurance company? How are the providers being reimbursed? And this hopefully gives you a taste of some of those very important questions. Thank you.